What do you do for a living?
I am a clinical and forensic psychologist.
What's your educational background?
I started college at Georgetown University. I then transferred to the University of California, Irvine, where I received my bachelor's degree in psychology and social behavior. I completed my master's degree in psychology at Pepperdine University.
Dr. Shannon Curry might just have proved that Amber Heard's expert falsely diagnosed her with PTSD. The two psychologists have been going back and forth as they stick to their own evaluations of Heard. So what exactly was a fallacy in Heard's expert analysis? And how did Dr. Curry correct it? Watch this video to find out. Both Amber Heard and Johnny Depp have testified in the defamation case. Dr. Shannon Curry is the forensic psychologist hired by Johnny Depp's legal team who claimed that Dr. Don Hughes, the forensic psychologist of Amber Heard, misrepresented the tests and utilized them in the evaluation during their May 25th hearing. Dr. Shannon Curry is a therapeutic and forensic psychologist who has presented their testimony in the Heard versus Depp case. Dr. Curry is licensed in Hawaii and California and runs a counseling center in California. After contacting their legal team, Depp, in 2021, Dr. Curry assessed Amber Heard's mental health. In 2019, Heard was tested by her psychologist, Dr. Don Hughes, who diagnosed her with PTSD and presented her knowledge to the court. Dr. Shannon Curry stated on May 25th that Dr. Don Hughes misrepresented the results of Dr. Curry's evaluation of Amber Heard. Dr. Curry also stated that psychologists will limit their reports to the information discovered and avoid including personal as well as private information that will jeopardize the dignity of the persons concerned. Dr. Curry clowned Dr. Hughes for how she presents herself, reacts, interacts, behaves, and explains everything related to her field. She said that when discussing Depp, who she had not seen, Dr. Don Hughes mentioned some accusations that Curry believes Hughes used obsessive jealousy several times when asserting that these things are undefinable through psychiatric and testing examination. Dr. Curry said that Heard's PTSD symptoms were blown out of proportion, and she didn't believe Heard had PTSD. It's clear to her that Dr. Hughes didn't use the correct testing to diagnose Heard. It's based on Hughes's opinion. Dr. Curry further claimed that Heard exaggerated PTSD symptoms and engaged in defensiveness during the test, and claimed that Dr. Hughes falsified the results. She administered the personality assessment inventory, and it included multiple scales that are good at detecting minimization, exaggeration, and trying to claim they have good quality. There were clear indications that Heard was engaged in defensiveness in those tests. As per Curry, Heard's approach to multiple examinations was unusual. It appears to be influenced by the face validity of the exam questions. Dr. Hughes said Ms. Heard has PTSD. Do you agree, Dr. Curry? On that, Dr. Curry said no, she didn't. She did a 12-hours-long assessment and read copious notes speaking of Heard's symptoms. She also studied Heard's legal documents and said there was no evidence of PTSD. Moreover, Dr. Curry discovered Heard was a borderline personality disorder as well as a histrionic personality disorder. She conducted her examination on 2 separate dates, 10th and 17th of December 2021. Dr. Curry said Heard externalizes blame and can be self-righteous, judgmental, and has anger issues. She added that there is a desperate fear of abandonment among borderline disorder patients. The reaction to that is to try keeping a significant close, which is extreme behavior. Dr. Curry said that all of it is like pistons of the engine, kind of firing off as well as igniting each other. But she continued, when someone is afraid to be abandoned by anyone, including their partner, and they have this disorder, they will make different attacks to prevent that from happening. And those attempts can be physical aggression, threatening, or harming themselves. But the behaviors are highly concerning and extreme to the people around them. With time, the explosive anger that they show when someone needs space or is not doing anything wrong, because many times they read into things that they perceive as being a slight to them or being someone intending to harm them that is not really happening. So they'll explode, exaggerate it, and will react in a heightened manner. Dr. Curry says those with this disorder can appear socially sophisticated and charming, but can blow up and be unaware of problems in their thinking. They are concerned about appearance, can be cruel, and struggle with admitting faults, prompting different issues in a relationship. Reactions are violent and aggressive, and they are abusive to their partner. They may also use the legal system to stop their partner from leaving them by threatening or applying for a restraining order. One of the common approaches is physically assaulting and getting harmed themselves, and we call this administrative violence. These people feel slighted easily and do not attempt to control their anger or emotions. On the contrary, they will do everything to express anger. Histrionic and borderline appear as two sides of the same coin. For histrionic personality disorder, it's required to be the center of attention. A person will make stories about a princess or victim. A person with histrionic disorder will have an underlying drive always to be the center of attention, and they use their attractiveness or good looks for respect and attention. Dr. Curry said there was evidence that Heard was exaggerating symptoms of PTSD, and there was no evidence supporting that she was suffering from that. It's likely a fake disorder, and it feels anxious. People have seen war movies and movies depicting someone having PTSD. Heard didn't have PTSD, and there were significant indications that she was exaggerating its symptoms. Heard claimed to be suffering from 9 out of 20 major symptoms of PTSD, post-traumatic stress disorder. Let us know what you think about Heard's alleged PTSD struggles in the comment section down below. And as always, stay subscribed for more.